Hello, my name is Rishi Nathan. I'm a doctor of physical therapy student at PCOM. How are you doing today?
I'm doing good. How are you?
I'm doing well. First thing first, do you feel comfortable in the chair and all that?
Mm-hmm.
Did they get you?
Yes, everything's great.
Great, awesome. Good, so let's get started. I just need to ask you a few background questions if that's okay with you.
Mm-hmm.
So first, can you tell me your first and last name?
Meghna Nathan.
Sorry, I tend to lose track of the days. Can you, do you happen to know the date today?
September 8th, 2023.
Yeah, sure. Oh, already September, okay. And where's your date of birth?
7/20/92.
Alright. And it says here in your file that you have a Blue Cross Blue Shield, is that correct?
Yes.
Okay. It also says that you identify as an Asian female, is that correct?
Yes.
And are there any specific pronouns that you go by?
She, her is fine.
Now I just want to clarify, it says here that you don't have an advanced directive, is that correct?
Not right now. I need to get one.
Alright, so yeah, just be sure to bring that to us when you do have one, so we can put that in our file.
Okay.
And then, what hand would you say is your dominant hand?
My right hand.
Your right hand? Okay.
Yeah.
And so, please tell me, what services are you seeking today?
I wanted to get physical therapy since I had my baby in December, and I started to try to run for exercise like I used to about 3 months ago.
Mm-hmm.
And I started experiencing knee pain while running. It goes away when I stop running, but just while I'm running, I feel a lot of pressure in my knees, so I just wanted to make sure that I was getting back to running safely. So I wanted physical therapy to help me do that.
Gotcha, okay. Yeah, we can definitely work on that. On a scale of 0 to 10, 0 being no pain, 10 being you need to go to the hospital like right now, where would you assess your pain level right now in the moment?
In the moment, 0.
Alright, and then when you're running?
No more than a 2 or 3.
Okay, 2 or 3, alright. And then do you do any sort of other exercises or anything like that, like any extracurricular habits or anything like that?
I do yoga.
Yoga?
I do yoga, and I walk, but that's about it.
Alright, and no pain during that?
No pain for those activities.
Okay, gotcha. And so how would you describe your pain exactly?
The pain is kind of just like generalized pressure around my kneecap,
Okay.
and kind of behind my kneecap almost.
Okay.
It just feels like pressure almost, like that tension, I want to say. It's just uncomfortable enough where I feel like I need to stop running. I
Okay.
don't want to injure something or strain something.
Does it feel like it's unstable or anything like that? Or
Maybe a little bit
Okay.
unstable, yeah.
Alright.
I feel like my gait has been different since I got pregnant
Okay.
and had the baby.
Alright, and then, so when exactly would you say the pain, like when it started? So it started after your baby or before your baby?
After my baby, when I tried to start running 3 months ago.
Okay, and there's nothing beforehand?
No.
Okay, gotcha. And how long would you run for?
Honestly, not long. Even before the baby, I never did more than like a 5K.
Okay.
So really, I was only trying to do like 1 mile. So it was like after, maybe like a quarter of a mile, it started hurting and not feeling good.
Is it immediate when you start running, or
Yeah.
is it like after the end of the mile? Or
Immediate when I start running.
Immediate, okay, gotcha, okay. And what do you do to alleviate the pain? Do you take medications or anything
I don't really need to, because as soon as I stop running, it goes away. So really, that's the cure. I just stop running.
Gotcha, okay. And does it bother you to sleep at all?
No,
Any pain
not at all.
Alright. And has it been limiting your daily living?
No.
Anything at work? Has it been bothering you at all?
No, I take the stairs at work and that goes fine. I walk long
Okay.
distances, that goes fine.
And
So,
then
no.
bending down,
Mhm.
that's all good?
Totally fine.
Alright. And what do you do for work?
I'm a speech therapist at Emory Midtown with the head and neck cancer department.
Alright, very cool. And where'd you go to college?
I went to UGA for undergrad and Rush for grad school.
Oh, very nice. And have you been to a physical therapist before?
Yeah, I did go a couple years ago. I had a strain in my neck, so
Mhm.
I went to physical therapy for that. I just did like 5 or 6 sessions, nothing crazy.
Okay. And did it help?
Yes, it did.
Good. Let's see here. Have you had any surgeries recently?
No surgeries.
Okay. And do you have any immediate medical conditions that I should be made aware of?
No,
No? Alright. And are you allergic to anything?
no allergies.
No, nothing with latex or anything like
No,
that?
I'm good at latex.
Okay. And has your doctor placed you on any contraindications or precautions for physical therapy?
No, not that I'm aware of.
Does your immediate family members have any major medical conditions that should be made aware of?
Not really. My mom has arthritis,
Okay.
but other than that, nothing crazy.
Okay. Does she have it in certain joints or?
Yeah, I think so. I think it's like both of her knees and
Okay.
her hands sometimes are painful, but she's also had some injuries in the past, so
Okay, gotcha. Okay.
probably affecting it.
And who do you currently live with right now?
My husband and my 8-month-old.
Okay. Nice. And what kind of household do you live in?
I live in a condo.
Mhm.
It's 2-bedroom, 2-bath.
Okay. And are there any stairs?
No stairs getting into it, and no stairs in the house.
So it's on the
all
ground?
all one level.
Okay.
Yeah, on the ground level.
Gotcha.
Mhm.
All right. So to provide the best possible care, I need to know, do you participate in any recreational habits such as drugs, alcohol, or anything like that?
Very occasional glass of wine, but even that it's like so rare because I'm breastfeeding, so I'm
Mhm.
not really doing much of that.
Gotcha. Okay. And I noticed in the documentation that says that you are Hindu. Based on your social, cultural, and personal background, is there anything that should be made aware of, just so I can be respectful of that?
No, it's pretty much.
Lastly, so what are your goals for physical therapy?
I just want to be able to get back to more exertive exercise, like squatting, running, like things that require more more strength from my knees.
Yeah.
But I want to be able to do that safely. It just doesn't feel safe right now based on the pain that I'm feeling. So I just wanted to get some physical therapy to re-strengthen in a systematic way and a safe way. So
Okay. Yeah,
that's my idea.
we can definitely make that happen. All right, so I'm gonna begin my physical exam on you now. I'm gonna test your mobility and strength. Do I have your consent to start that?
Yes.
Great. And during this eval, I assess the patient's emotional response, both verbal and nonverbal.